Hello, good evening, and welcome to the Functional Medicine Podcast, the Functional Solution Podcast. My name is Tal. I'm the Educational Director at the American Academy of Functional Health. And with me, we have our co-host, Dr. Esha.
Hey, how you doing? It's good to see you.
Yes, good to see you too. And it's a beautiful summer, at least here in the Northwest.
I'm glad you would describe summer. That it's a brutal. I would use a different B word. A brutal summer here in the Midwest.
Yes, I know. And there's nothing to, there's nothing. Even if it gets a little hotter in some days here, it's still wonderful because
Nice.
because it's pretty much rainy most of the year here.
Yeah.
So it's a nice summer. The rest of the year is depending who you ask, but
Yeah.
the summer is really nice.
Nice.
So we're very excited about today's topic. We're going to talk about nutritional deficiencies and weight gain. And this is sometimes it sounds to some people contradictory because the perceived notion that patients that are overweight or obese have higher consumption of calories.
Mhm.
But it's not true for every patient, right? As we know, when we start looking into the real root causes of their metabolic dysfunction, we understand that it's not always the classical, right? Eating more calories or
Right.
burning less calories, right? It's not always that. That's not really the cause in most cases. But even when we're looking at patients that do have high caloric consumption, right? Maybe because of eating fast food or processed food, right? Which has a lot of high fat, high sugar, right? We're still seeing a lot of that concept of overfed, undernourished.
Right. Yeah, that's a really common thing I see also in practice. A lot of people that I see, when you just go over basic conversations about diet and a lot of it is education, right? A lot of people don't understand kind of micronutrients and where you find these things. So I do agree with you in that, a lot of times we're seeing people who are overfed but undernourished. So I'm really excited to talk about some of the micronutrients tonight and deep dive there.
Yes, absolutely. And this is especially where it's important for not just any any primary care provider who might be listening to us tonight, who might be with us tonight, physicians, nurse practitioners, PAs, but every healthcare provider, right? Because this is so prevalent,
Mm-hmm.
right? And a lot of patients are out there trying different things, different weight medications, and trying different
Yeah.
liposuction surgeries, and their patients are investing hundreds and thousands of dollars into those therapies, and unfortunately, most of those do not really resolve the underlying dysfunction, right?
Right.
That leads
Right.
to gaining weight. So when you look at the statistics, we're really seeing an increase in the rise of obesity in the last few decades. With that also comes metabolic dysfunction, type 2
Mhm.
diabetes, and also cardiovascular conditions, right? And that's something that I'm sure you've seen, right? As a
Oh
practitioner,
yeah.
Dr. Esha, this is
Yeah.
something that
I would say probably 70% of the people that I've seen have metabolic dysfunction, right? And they're not all coming to me for that. They're coming usually for gut issues, liver issues, or something else. And we kind of deep dive or discover the metabolic picture running, fasting insulin, right? Or running A1Cs, and just kind of as a standard set of labs, you'll discover these things. So I think that every patient, regardless of what they're coming in for, should be screened for metabolic issues in some capacity.
yes, absolutely.
Mhm.
And it's really interesting. Also, I'll add something to what you were saying, which is they're coming from metabolic dysfunction. Maybe they're coming for diabetes, or they're starting to develop neuropathy or whatever it is. And one of the things that we also have to remember is that excess body weight and obesity can contribute to so many
Yeah,
of these diseases or
that's right.
additional diseases, right?
Mhm.
That also includes the risk of several types of cancer as well.
Yeah, that's true.
So that's where it's really important to talk about this topic, and for us as practitioners to have to understand the mechanisms, and also have like quick references, treatment
Right.
protocols that we can say, okay, here's like one supplement you can try to support healthy metabolism. Here's one dietary. Here's one
Yeah.
lifestyle. Start getting them in the right direction, because they're not going to get any of those recommendations from the primary care standard of care visits, right?
Yeah. Correct.
I don't know if you heard this in the same way that I heard it, same uh, um, exact terminology, but I remember so many patients. I would ask them, "So um, what did your primary care doctor have to say about it?" And they say, "Oh, they told me I need to lose weight." And I'm like,
Yeah. Oh, yeah. I've seen that. I just remember you said that. I had a case when I was in residency, and I was working with these gastroenterologists, and we had a guy come in with fatty liver disease. And the GI doctor I was working under, he said, the patient says, "What do I do about this?" Like, "Oh, just lose some weight." And the patient's like, "What does that mean?" So yeah, I think it's the easy way to just kind of offload sometimes like responsibility. "Oh, just lose some weight." And patients are supposed to figure that out on their own, but you really need help trying to figure out what that looks like.
yep, what that looks like, what's driving it, right? Is
Yeah.
it something in their gut? Is it thyroid? Is it other sexual
Right.
sex hormone imbalances? Is it a adiponectin or leptin imbalance?
Right.
Is it environmental? I mean, there's so many things, right, that we have to look into to really help them from a medical standpoint. But I think again, a lot of it stems from the old-fashioned approach, which was so heavily in the in the medical and some nursing school as well. Is that because I remember that like 22 years ago going through the training, and I'm like, the easier approach is like, what the answer to the question, why do you gain weight, is, well, you're eating too much, you're not exercising
Hmm.
enough, right? But the reality of it is so many of our patients have not changed their diet. They don't consume more calories as they
Right.
did 20 years ago, right? And then some of them try to lose weight. They try different diets and cutting calories and exercising, and I've seen that firsthand, the frustration of so many patients when I was like 20 years ago, when
Yeah.
I was doing fitness training in the evenings, and I saw the struggle, right, of so many patients keep struggling
Yeah.
despite the fact of lifting weights and all that stuff. So tonight we're going to focus on a slightly different angle. We're not going to talk about the mechanism per se of weight gain, but we're going to talk about a different angle that many of those patients struggle with, and that is the nutritional deficiencies. We're going to talk about specifically what types of nutrients that your patient might be deficient are essential for healthy metabolism. So this is going to be very, very interesting, and we're going to focus on probably three groups of nutrients that are important for metabolic function. But first, Dr. Esha, tell us a little bit about the weight gain as a metabolic disorder.
Yeah, yeah. So I think honestly, every year when I'm watching the news, I see like, new reports. Like this year, we're seeing more and more of this metabolic issues, diabetes, weight gain, things of that nature. So I think that there's just a general increasing trend of weight imbalances that we're seeing, especially here in America, namely specific weight gain. So ironically, despite excessive caloric intake, weight gain, obesity, overweight, it's commonly associated with nutritional deficiencies, right? So more nutrient deficient meals. So before we deep dive into the specific nutrients that Dr. Tall mentioned, let's just take a look at this image from the journal Lancet 2024. And it's showing us the prevalence of overweight and obese adults. So the very top left, you're seeing older males, 15 to 24 years old, and you see kind of the bar at the bottom kind of ranging from 40 to 60. So that's the prevalence of overweight or obese populate males in that specific state. And then you'll see to the right, age 15 to 24 females, and you'll see it more in the South. You tend to see a higher prevalence compared to some of the more northwestern states. And then the very bottom left, I would say, or that second column or second row, you'll see the 25 and up age range. And you'll see like basically all orange and red, right? So as we get older, we're seeing more metabolic issues compared to when we're in our teens and early adulthood. So that's for males. And then to the right is for females. And so that's over 25. So kind of same southern region demographic carrying a higher prevalence there. So, like Dr. Tall mentioned, there are many different mechanisms by which weight gain or obesity can contribute to nutritional deficiencies, and then vice versa. Nutritional deficiencies can contribute to, weight gain, metabolic issues, obesity. So oftentimes with metabolic disease, poor diet characterized by high intake of energy-dense, nutrient-poor foods is a major contributor to obesity while simultaneously leading to micronutrient deficiencies. And then, like I said, vice versa, a lot of times just poor nutrient diets over time, and we'll show you some mechanisms later, can impact metabolic issues or lead to them. And then also individuals with weight gain, obesity, chronic inflammation, they can have impaired nutrient absorption and utilization, which can just further compound the risk of deficiencies. And then, like Dr. Tall mentioned in the beginning, you see a lot of the treatments are focused around, medications or surgical procedures, but specifically surgical procedures, bariatric surgeries. I commonly hear and see patients who've had these procedures and they just are struggling with getting in certain nutrients, just general nutrition, honestly. And so that can kind of also trigger metabolic issues in a way. So over time, micronutrient deficiencies in individuals with obesity can negatively affect physical, cognitive, emotional health. So it's not just that these micronutrient deficiencies or nutritional deficiencies are contributing to further metabolic issues. They also contribute to mental health issues, cognitive issues, emotional health issues, which can all further, ironically, kind of keep you in this loop contributing to metabolic disease. So as functional, medicine practitioners, we have a unique opportunity to support our patients' metabolic health and kind of monitor nutrient levels. They're a really nice test, functional medicine test, and also just general labs you can do to kind of get a good lens into nutrition. I think the functional medicine tests are a little more in depth, and they look at a bunch of different nutrients and micronutrients as well. Especially for people who are undergoing like weight loss treatments with diet and targeted supplementation. I do think it's worthwhile to kind of follow them and trend them with labs. So let's jump into a pop quiz. So the first quiz, which medical interventions are known to increase the risk of nutrient deficiencies in individuals with weight imbalances, obesity? A, physical therapy and massage. B, sleep aids and antidepressants. C, bariatric surgery and certain weight loss medications. And then D, antibiotics and antiviral medications. I'll give you a few seconds. Alrighty, so the correct answer is going to be C. We just talked about that one. Bariatric surgeries and certain weight loss medications can actually increase risk of nutrient deficiencies and further potentiate issues, metabolic issues. So now we'll kind of jump into specific nutrient components that have been shown to impact metabolism and weight imbalances, weight gain.
Yes, absolutely. And I just want to mention the beautiful background that you have, Dr. Esha, because I know that we talked about it, but the viewers probably can see it. It's just this beautiful herbal medicines.
Yes.
So that's just wonderful to see. And
I think I'm happy my wall gets a shout out in the podcast today.
Yeah, so absolutely. Shout out to Dr. Esha's wall. That's beautiful.
Thank you.
So this is where we're diving into the more specific nutrients, and there's several nutrients that we talk about. And as I mentioned, we try to make this as kind of focused really on the clinical application. We're going to talk a little bit about the mechanisms and how essentially that how it works, so you have a good understanding of the scientific background. But what we really want to focus on is the clinical application. How do we actually use those in practice, and what you might consider in terms of recommendations. And this is, again, because as Dr. Esha mentioned, it is very prevalent. If you're asking yourself how prevalent, just across the United States, the CDC is mentioning that, reported that with adults age 20 and above, the rates of overweight and obesity are 73%. So about 7 out of 10 adults, statistically across the United States, are struggling with either overweight or obesity. Right. So let's go into the first one, and the first one is magnesium. So magnesium is, as we know, essential nutrients for multiple functions in the body, probably over 300 biochemical reactions, and it is really essential for generating energy. Right. So in our mitochondria, magnesium play a key role in the energy production process. Also part of the building proteins, supporting genetic material such as DNA, RNA, and also maintaining proper function of the muscle and the nerve activity. Now, when we look at the deficiency, right, it's reported to be commonly seen with individuals with metabolic disorders. That includes both obesity and weight gain. And the long-term perspective and cross-sectional studies have reported that higher magnesium intake consistently is associated with lower risk of obesity and reduced body fat levels. So, for example, for adults age 19 to 30 group, the recommended daily intake is approximately 400 milligrams for men, 300 milligrams for women, right? So 400 milligrams for men, 300 milligrams for women. That's the daily recommended dose. But in a 30-year cardiovascular study that they looked at 4,000 participants, nearly 45% of men and more than half of the women were consuming less than the recommended amount of magnesium, which means that most of the participants are likely, and likely many of our patients are not consuming enough magnesium on a daily basis, right? So if we apply what we look at the result of those surveys and reports, it's very likely that so many of our patients, right, let's say between 40 to 50% of our patients might not be consuming sufficient amount of magnesium. So let's take a look at an interesting article, an interesting picture, and this is from the Journal of Nutrients, and it was published in 2021. And we can see how magnesium, through different mechanisms, can contribute to weight gain and obesity, right? So, for example, magnesium deficiency can impair insulin signaling and glucose tolerance, which could lead to insulin resistance. It could increase glucose levels. It could, and we know that if you have excess glucose levels, that would be stored in our fat tissue as triglycerides, right? We know that also excess glucose and oxidative stress can cause low-grade inflammation, right? So we know that inflammation, if your patient has elevated glucose levels and they have systemic inflammation, that's a recipe for increase in body weight. Right, we know that, and we go much more in depth into that, and the inflammatory pathways that are involved, hormonal pathways that are involved in the functional weight loss certificate training. But here, what I like about this picture is that it really makes it very clear to see how magnesium deficiency can lead to low-grade inflammation, oxidative stress, increase in some cytokines, increase in circulating C-reactive protein, which can lead or contribute to metabolic syndrome, right? And that can contribute to type 2 diabetes, right? All of those, of course, also alternation. If we have a state of inflammation, that can contribute to alternation in the gut microbiome, right? Composition, and also the amounts, right? Which they're referred to here as the structure, but essentially it's the amount of certain bacteria in our gut. So this is a really interesting, you can read more. We have the citation on the right side of the screen. But then we ask ourselves, if we support an increase of magnesium, right, what might be the results for that? And this is really interesting. There was another meta-analysis that we looked at. It was published in the British Journal of Nutrition. And they looked at 12 studies with 997 participants. And they found that magnesium supplementation was associated with a lower waist circumference in obese subject with BMI of over 30. So what we're seeing essentially especially with patients that have a higher BMI of over 30, magnesium supplementation could be beneficial in reducing fat tissue. So now the next question is, of course, clinically, right? Which magnesium should I recommend my patients? Because there are so many different types of magnesium. And each magnesium, when we talk about clinical nutrition, has slightly different function, right? Some has better absorption, some has less, some have more of a GI impact, some have more systemic impact. So there's two types of magnesium that we will typically look at for patients who struggle with overweight or obesity. The first one is magnesium malate, and we're going to post the name here, magnesium malate. And essentially, magnesium malate is a combination of magnesium and malic acid. And it is a compound that involved in the Krebs cycle. And so this is essentially a compound that is used in the body to produce ATP, right? Those are the molecules of energy. And so this is the process in which, in a general view, this is the process where our body takes in lipids and sugar and all of that, and it processes it, right, to oxidize it to produce molecules of energy. So this makes magnesium malate popular choice for boosting energy and supporting metabolism. Now, on the screen, you can see one of the professional grade products. We are not, the American Academy of Functional Health are not affiliated with any supplement companies. So we're not, we just look at the study and what's evidence-based practice, and then where can you find that specific compound in a professional grade supplements. That's how we work, right? So we want to use an evidence-based approach and a professional grade supplement. So in general, the recommended consideration dosage for adults is between 200 to 400 milligrams of elemental magnesium per day. You can divide it into 1 or 2 meals, and it's sometimes better to take with food. This particular product has 360 milligram of D-magnesium malate, and it's about 180 milligrams of elemental magnesium per serving, which is two capsules, right? So this would be one consideration for patients that have a cellular metabolic challenges, right? And then, of course, there's in the functional medicine program, the advanced functional medicine program, we go into how do we test it, right? There's metabolomics, there's organic acid, there's multiple tests and different pathways that we want to look at. But let's say the more straightforward, fastest recommendation is this magnesium. And then if your patient, this is another clinical scenario, if the patient in front of you is struggling with overweight or obesity and metabolic dysfunction as a type of insulin resistance or that type 2 diabetes, then we might want to consider magnesium citrate, which is not this one. It's a different type of magnesium. So we can clear this picture off the screen. So essentially, magnesium citrate is more designed or more intended to improve insulin sensitivity and glucose control. It is well absorbed, and it's commonly used in clinical studies on metabolic syndrome. So it also helps if your patient is constipated, right? Which is never a good thing for their gut microbiome if they're constipated. So those are two recommendations. Again, this is where when we teach functional medicine, we teach also nutritional medicine, so you can do what we call precision medicine, and that means is customize the treatment protocol for each one of your patients based on their unique physiology, unique situation, unique condition, right? So there's like probably 5 or 6 or 7 different types of magnesium we can talk about, but those two are more specific for those situations, right? So with that being said, let's go into our next quiz, pop quiz. And the question is, which of the following statements best reflect the role of magnesium in metabolic health and weight regulation? Option A is magnesium is primarily important for bone health and has little effect on metabolic function. B, magnesium plays a vital role in energy production, insulin regulations, and low levels are linked with increased risk of obesity, inflammation, and metabolic disorders. C, magnesium deficiency mainly affects cognitive function but has no relationship with body weight or metabolism. And D, most individuals easily meet their magnesium needs through diet, so deficiency is uncommon. So which one do you think it is? Which one is the correct answer here for magnesium in metabolic health? I'll give you a few seconds. You can put it in the chat if you want to. And the correct answer is B. Magnesium plays a role in energy production and insulin regulation, and low levels are linked to increased risk of obesity, inflammation, and metabolic disorder, right? We already talked about how magnesium deficiency ranges in studies between 40 to 50%, especially with patients with metabolic dysfunction, right? So that is something to be aware of. And this is magnesium is the first one we chose to talk about, but there is another one that is really, really important, another group of vitamins that are so important. And Dr. Esha, I know that this is, we started talking about magnesium because it's important for so many factors, right?
Yeah, magnesium is so popular in the functional world, but it's like so. Also, I still very underestimated in like how powerful it is. I'm curious because I usually will do like a red blood cell magnesium or, some of the functional tests. I know SpectraCell has like a micronutrient test. Are there any tests that you typically go to for like nutrient testing?
Yep. So I personally see the gold standard as the micronutrient testing, which measures in white blood cells, because there's actually studies that I looked to, and they compared between levels in the blood, in the hair, in the white blood cells, and it was really interesting to see the authors kind of in general concluded that blood levels of nutrients can fluctuate fairly rapidly, and they do not actually properly represent the amounts of intake in the cells. And we also have to think about it because in some situations our body will pull, for example, calcium from the bones into our bloodstream, right? Does that mean that represents the normal situation, right? If we're starting to, right? So we have to look at it as our body constantly shift in terms of homeostasis, right? There's another interesting study talked about zinc. If there's a state of infection, the patient might not be aware of it, right? But if the body is fighting something, it will pull zinc out, right? Into the bloodstream for the immune cells to utilize the zinc. But that doesn't really mean that the patient has that levels of zinc when we measure them, right? So that's what we measure intracellularly. It's better to do. And of course, we talk much more about it in the advanced program. But this is where we go into our next group.
Yeah, thanks for answering. I was just curious as to what you see. I tend to believe the same thing. So B vitamins, which I think B vitamins are also really popular too, but B vitamins have a special role in metabolism. They're a group of nutrients most commonly associated with metabolic health and energy production. Many of our patients are on B complexes or multivitamins that have B vitamins in them, or they're on hair, skin, and nail formulas that have a bunch of B vitamins. Also, there's a popularity of B12 shots, right? Or these kind of weight loss injections, and a lot of times they can contain vitamin B12. So they're very popular vitamins. However, they're also, I think, another underestimated group. So across various studies looking at like waist circumference, visceral fat, which is like that kind of tough fat around organs, and abdominal fat, and body fat percentage, it has been shown that higher levels of B vitamins are generally associated with reduced odds of obesity due to factors like poor diet, impaired absorption, and altered metabolism. Overweight, obese individuals tend to have deficiencies in B vitamins. And I think about, just gut health too. So always just assessing a patient's gut health, because you can give them all the supplements in the world or protocols in the world, but if they have poor gut health due to underlying chronic infections or imbalances, just kind of having, creating expensive urine, right? So you want to make sure that you're checking their gut health out, especially when people have metabolic issues. There was a really interesting study that came out a few years ago showing how intestinal hyperpermeability, leaky gut, can sometimes be enough of a culprit to trigger metabolic issues. So gut health is really important there. Okay, so let's take a look at this image from a 2024 journal showing how B vitamin deficiencies may contribute to weight gain and obesity. So we're going to go through some of the mechanisms, not all of them. So number one is like in the top right corner, you see the B6, B7, B3, B12, B9. So lower levels of these vitamins can interfere with energy metabolism. So they're showing you a cellular process there, potentially triggering oxidative stress, inflammation, and increased fat production, which is a lipogenesis you see kind of at the bottom. And so that's number one way that the Bs can impact metabolic health. We're going to jump to number 3, which is kind of right diagonal. So the B1, B2 are correlated with increased body mass index, increased BMI. So lower levels of those B vitamins outside of the previous picture we talked about. Number 4, you'll see vitamin B6 specifically. B6 helps to control how certain genes related to fat storage and fat cell development are turned on or off. So one of the key genes that it influences is called the PPAR gamma, which is peroxisome proliferator activated receptor gamma. This is a really big gene in the fasting world and the mitochondrial health world and longevity world. So if you're into all that type of stuff, you'll see this one commonly talked about. So the PPAR gamma, vitamin B6, is associated with supporting and activating, influencing those genes. So that's number 4. Number 5, which is at the opposite side of number 1. So the left corner, top corner, lower levels of B1, B3, B6, these reduced concentrations of these vitamins are significantly correlated with increased risk of insulin resistance, metabolic dysfunction, and subsequently obesity is in that picture too. And then number 8, we see a bunch of different B vitamins and how higher body weight can lower vitamin. Are we on number 8? Yes, number 8. No, a higher body weight can lower vitamin B6 levels by causing oxidative stress. So it goes back to the picture of adipose tissue or fat tissue being its own organ, right? Because now it can influence different vitamin processes. So it can actually lower your B6, which can cause oxidative stress and disrupt a normal cell messaging system, your cytokine system. So that's a really, really cool image. And the citation is there if you want to dig a little deeper in that study. They took a really deep dive into the B vitamins and how they impact your metabolism. And so just also when you think about the Bs, because I think oftentimes patients will hear, B vitamins are water soluble. So if you take them and you take too much and your body doesn't need it, you'll just pee it out. However, too much of anything is not a good thing. So you can't overdo the B vitamin. So that's another reason why I recommend kind of having testing as you go along and just kind of monitoring things. But there are some really good B vitamin complexes out there that are well dosed, if you will. And so I just think it's good to be aware of your patient's baseline. I wouldn't just throw, a high dose B complex at somebody. You want to make sure you're tailoring your supplementation appropriately. So, I know this is a bunch of information, right? So if you're interested in learning more about the Bs, about weight loss strategies for your patients, specialty testing for micronutrients, clinical nutrition, and just more root causes of metabolic issues, of course, log into your advanced and clinical functional medicine platform. You may also consider checking out our functional weight loss program, which is starting next week and includes a specific review of mechanisms, tests, and treatment protocols for weight gain. So as you can see on the screen, this is the functional weight loss program here. A really great value, by the way. Okay, so we're going to do the next pop quiz. Okay, so which group of individuals is more likely to experience B vitamin deficiencies? A, those with a balanced diet and healthy weight. B, overweight or obese individuals due to poor diet, impaired absorption, and altered metabolism. C, athletes who consume supplements. D, children under 5. All right. So the correct answer, which I'm sure everybody got right, is going to be B, overweight, obese individuals due to poor diet, impaired absorption, and altered metabolism. I think the Bs are really important. And I think that, most people are aware that B vitamins are important for metabolism, and you see them so much associated with weight loss, but it's also still a good idea to test and check, and then also be cognizant of MTHFR, right? If your patients have MTHFR mutation, you want to be cognizant about the types of B vitamins. I will say most professional grade supplements use methylated forms of folate. So it's not really so concerning, but just something to also keep in mind.
Wonderful. I'm so glad we talked about those two groups, right? The magnesium and the B vitamin groups, because those are so essential. And just as something, quick question that I wanted to ask you, because this is sometimes we don't think about it, but most patients take vitamins in capsules. Right. Mm-hmm. What is your preference when you're recommending patients, like, let's say, B vitamins or a multi? Would you recommend them a liquid form or capsules? I
think it just depends. It just depends. If I have patients that are only used to taking prescriptions, are usually tinier capsules. Sometimes I'll recommend powder formulations. There are a few of them that are really good out there. And then sometimes I'll recommend liquid. And if they have sometimes a history of GI issues, or they have a really sensitive belly, I may recommend either of those, but just recommend they take it with more of a fatty meal, things like that, to help mitigate. So I'll do mostly anything based on the patient's preference and their history and GI picture. What about you?
Yeah, so I like your approach of what is the patient preferring. I know that some patients don't like to take a lot of pills, yeah. So looking for a liquid form or powder form is easier. They can just mix it with water. I tend to, with older patients, recommend liquid form.
Yeah.
Because there was one interesting study I read once. It was in 2016, the Journal of American College of Nutrition, and they found that liquid, they used multivitamin in their study, but they found that liquid led to a higher serum level of certain nutrients when they compared it 12 weeks versus a pill. So that's typically if it's an older patient and we don't need to wait for the tablet to dissolve and all of that, then we'll typically use multi, that is absorb or liquid form of B vitamins, absorb much better.
That makes sense.
Yeah. And of course, what are your thoughts about the under the tongue or spray B12, which supposedly have better absorption?
Yeah, I think that's appropriate. I've used plenty of like spray or like lozenges type of products for vitamin B12. I think that, you obviously have high vascularity in the oral cavity. So yeah, again, I think it just kind of, for me, a lot of times like patients take so many pills already that I'm trying to find ways to reduce their pill load. So liquids or dissolvable things seem to have better compliance. What about you?
Yeah. So I tried for a period of time the dissolving tablet, which is it's kind of like it's like a tablet. They just kind of put it in their mouth and it dissolves slowly for sublingual, kind of a sublingual form. But from what I understood, the concept of kind of passive diffusion, it allows a little bit of higher dosages when you do it like that. And I'll typically do it with, again, either older patients or if I see on the lab that the patient has B12 deficiency.
Yeah.
So I think both could be useful, but that's something just to be aware of, right?
That's a good point.
Yes, because especially with patients that they have, they might have digestion problems. They might had abdominal stomach surgery, or maybe they're on PPIs for a long time. We have to remember that we do need the intrinsic factor. It's a protein in our stomach to properly absorb it in the small intestine, B12. But passing diffusion can, there's some indications that could get a little bit higher absorption.
Yeah, that makes sense. And I think those nuances are definitely important depending on patient populations that we're dealing with, because a lot of people do come in with already issues with absorption and capacity to retain nutrition. So that's a really excellent point.
Yeah, absolutely. So with that being said, let's go into our last section, which is the fiber. So we're going to talk about fiber consumption. And of course, fiber is really important for not just regulating our appetite, supporting digestion, balanced metabolism, but it's also really important for our gut microbiome. We always talk about fiber when it comes to how important it is to feed those beneficial bacteria and ferment these beneficial metabolites like short-chain fatty acids. But studies consistently show that people who eat more fiber tend to have lower risk of obesity and better metabolic health overall. So the recommended daily intake is between 25 to 35 grams of fiber per day. Unfortunately, when you look at the overall reports, most Americans only consume between 11 to 19 grams on average per day, right? So it is essentially close to about half of what is the recommended dosage. Now, physiologically, if you work with patients that struggle with weight gain or obesity, it's also important to know that fiber has been shown to stimulate, consumption of fiber is shown to stimulate the secretion of GLP-1, which is a gut hormone that regulates glucose metabolism and appetite. It also plays a role in improving insulin sensitivity. So if your patient doesn't eat enough fiber, they might get a prescription of GLP-1, but what happens when the prescription ends, right? When they stop taking that medication, right? So we want to help to encourage our own body to secrete GLP-1. And also fiber slows down the nutrient absorption, may contribute to reduce intake of food, right? It makes us feel fuller, right? And also reduces fat accumulation and absorption. Fiber also increases the satiety feeling, as I mentioned, and it also reduces hunger. So let's take a look. There's a really interesting study. This is published in 2023, and in the journal Critical Review in Food Science and Nutrition. And essentially, you can see several functions here, important functions here of the fiber. So one is the gut-brain axis, which we're not going to get into too much, but the impact of several hormone-like peptides that are secreted, like GLP-1, for example, which reduce energy intake. It's also really important for our gut, right? So we talked about it several times, how it is, if you don't eat enough fiber, you can lose the diversity of your gut bacterium. Also, it's important for delaying the breakdown of carbohydrates, which keeps your sugar level a little bit more stable, right? And of course, by stimulating fermentation and secretion of short-chain fatty acid, you also improve insulin, also secretion of GLP-1 and insulin sensitivity, right? So here you can see essentially all the different parts and all the different organs that are impacted by consumption of fiber. We're not going to get into all of it, but this is just as a reminder, general reminder, that it is so important to eat fiber. Now, there was another interesting randomized control study that had adults and overweight participant, obese participant, and found that consuming high fiber rye-based whole grain products for just 3 months led to greater reduction in body weight, body fat, and C-reactive protein levels than compared to those who consumed wheat product. So this is really interesting because nutritionally, we don't necessarily have to have the patient cut calories. Yes, in some medical extreme situation, yes, but for most patients, we don't want to cut calories. We want to transition their diet to eating consuming, instead of, for example, wheat product, consuming more rye-based product that was found to be more beneficial, right? And this is why it's so awesome to learn nutritional medicine, because it's not about taking away foods from your patient. It's about giving them more option or better options that will serve them, right, 3 months, 6 months later, 12 months later, in waking up and having a better, a better body composition. They're going to feel better, you're going to look better, right? So this is all very important. So how much fiber is recommended? Let's go into a pop quiz. The last pop quiz, I think, for today, and this is about fiber. So if you've listened to my little section, you would probably know the answer for this. How much fiber is recommended daily for most adults? Option A, 10 to 15 grams. Option B, 15 to 20. Option C, 25 to 35. Option D, 40 to 50 grams. So which one is it? Okay, and the answer is C. 25 to 35 grams is the recommended dosage for the fiber. And of course, we talk a lot more in detail about the specific nutritional recommendations for each condition. If you want to learn more, log into your Functional and Nutritional Medicine platform and continue your developing your skills, your clinical skills, where we have specific classes on metabolic dysfunction, cardiovascular, autoimmune, hormonal imbalance, chronic pain, inflammation, and neurological conditions and other conditions, right? So that's where we talk more specifically about all of these, right? So Dr. Esha, this is really, really interesting. And of course, it's great to talk about what are the straightforward clinical application. And that kind of really leads us to talk a little bit about supplements, right?
Yeah, totally. And I'm so jealous that you got to talk about fiber and I did not. I'm obsessed with fiber and metabolic health. So we'll have to do a whole fiber deep dive one day. Okay. Yes. So supplements. There are many different products out there. Metabolic challenges like weight gain and obesity are obviously complex. It's not just, monolith. It's not just one thing we focus on. And as practitioners, I think it can feel really overwhelming sometimes when you're treating metabolic and targeting metabolic cases. But after a while, you kind of get your groove. But I will say initially, there's so many things to focus on and so many things to target. But with so many contributing factors, microbiome, environmental exposure, physical activity components, psychological components, you can just start with the basics, right? So one of the simplest and most effective entry points is just supporting the baseline, right? All the things your body needs to function at a basic level, which a lot of people, like we discussed, don't have enough of. The fiber picture, the magnesium picture, even some of the B vitamins, right? So you can start simple, encouraging patients to increase their fiber intake with their diet, fruits and vegetables, diversifying their diet with a variety of different fruits, vegetables, including quality protein sources, incorporating healthy fats that can, all these things can be a simple, powerful first step. And they're also usually a necessary step because you have to build those baseline habits in general. Now, in this next image, we're going to show you are two different products kind of correlating to what we've discussed. So one is a fiber supplement that I love, and then another one is a mineral complex. There are other fiber supplements out there as well that I use. But this fiber product has a really nice prebiotic blend in there, which we didn't really talk about, but the prebiotics help to basically grow your gut bacteria. So they're also like fiber in the foods and things of that nature. But this one contains a prebiotic, so you can support your patient's gut health with supporting their microbiome. And then it also contains a blend of different fibers to support overall gut health. And so I tell people, when you take a fiber, if you're taking it for, there's different rules around taking fiber. I typically will tell people, if you're taking it for like just bowel function, you want to take it with a meal. You want to make sure you're binding up the meal, right? Outside of that, if you're not really taking it for bowel function, you may just recommend taking it like on an empty stomach. So there are different ways to think about dosing fiber. If bowel health is your goal and constipation, you want to take it with the meal. But in general, for these types of products, if you're using them for metabolic health, you don't have to do that necessarily. And then outside of that, you'll see the complete mineral complex. So the mineral formula is a really nice one because a lot of mineral formulas don't have magnesium. I know we talked about magnesium, but if you're wanting to reduce their supplement load, you can just kind of use this complete mineral complex. It has a little bit of magnesium in there. I can't think of the type off the top of my head, but it's more of a chelated version of magnesium, a chelate versus like the citrate component. So that's the supplement picture. And then I would say, again, just to kind of recap, because we know this is a lot of information. If you're interested in learning more about the gut metabolism axis, you can always log into the course dashboard, the Advanced in Clinical Functional Medicine Certification Program, and just revisit those modules. You can also book a coaching call with us, which is just free, no cost to you as a part of your program. And then we can kind of get you started with some more functional medicine suggestions and tools. And that's that picture. So these are just two products, and Dr. Tal mentioned a magnesium product earlier. So these are just some really good practitioner, professional level brands to think about incorporating.
Yes, thank you. Thank you, Dr.
Yeah.
Esha. This is really helpful to talk about. And we got a couple of questions here we're going to finish with. And of course, we currently have a $2,000 scholarship. I just wanted to mention out for any of our guests, we got $2,000 scholarship for the Advanced Functional Medicine program, where you also get the phone app that is coming up in the next couple of weeks. And then it has all the treatment protocols in your phone, which is really cool. And then we also have $2,000 scholarship for the functional weight loss certification. So instead of $2,950, it's just $950. And we're going to be working with you for 2 months to get certified. This is a shorter program for certification. And then the new directory, which promotes our graduates, will be up and running in about 3 months. So any of the graduates of both programs will be shown on our directory that will be promoted across the United States, in the major cities mostly. So reach out to us if you have any questions about those, or if you're interested in applying. We'll be happy to help you with that. So a couple of interesting questions. The first one is, by Janet. So she's asking, should you err on the side of methylated B if you aren't sure if they have the MTHFR SNPs?
Yeah, I mean, I would say I don't think this is a controversial topic, but there's generally not an issue with using methylated B vitamins. However, I will say you can over methylate someone, and I've seen that happen before, and they just become a little more, well, what I've experienced, a little more wiry and anxious type mental, neurological kind of symptoms. And I think you'll find that consistent around kind of anecdotal reports from other doctors. But I would say, yes, you can overmethylate somebody. It's not common from my experience, but you also can, if they don't have MTHFR, which you don't know until you test, but if they don't have that, there are non-methylated B vitamins, right? If you don't want to use those, that are by some really great professional brands that you can find. But yeah, yes, it's generally fine, but you can overmethylate someone.
Yes, and this is where it's really interesting because it is a good answer, a really good answer, and I wanted to add something to it, which is really interesting, is that yes, you can overmethylate, and I completely agree with the general statement is that at least in my practice, the general philosophy is that we would typically use a methylated form of B vitamins because we know that there's some reports say 20%, some say up to 60% have some sort of, genetic variation that could impact the metabolites of B vitamins. For MTHFR is one example, right? But there's multiple different types of genes that are involved in those. So that's just as a precaution, like it's better to just give the methylated form.
Yeah.
Now another big hint that they might have a methylation problem without testing, going into more expensive testing, genetic testing, is if they have high levels of homocysteine, right? If you do a blood test, which they can get from Quest or LabCorp of homocysteine, and it's elevated, then that could be an indication of MTHFR or related gene. And then, I'll just add to you could overmethylate, like Dr. Esha said, and there are some, I've never encountered it, but I don't know, maybe you encountered Dr. Esha, is that, I still remember from one of my mentors who was talking about like, be careful with patients with anxiety or histamine intolerance, right?
Yeah.
So
I'm generally like you. I'll usually just do methylate it for everybody and then kind of see where they land or whatnot, go from there. But I'm generally kind of in the same school of thought.
Yes, absolutely. Yeah. The next question is, are excess folate and B12 inversely related?
I would say a lot of times you can high levels of folate, if somebody's like dosing with supplements, can throw off vitamin B12 levels. I don't necessarily know if they're inversely related or how the question is being asked, but I would say, yeah, in a way you can alter one by taking too much of the other, right? So, and then is that the same question? Can giving more B12 decrease excess folate? Okay. Yeah. No, I mean, you wouldn't treat a folate issue with giving more B12. Like they don't really balance each other out in that regard, right? So you'd want to figure out, get some testing done, the folate B12, and see which one's high and kind of go from there. But you can, if somebody has a deficiency of one, I always get this confused, and they're taking the other, it can actually mask the deficiency on lab work. So their CBC will look normal, but eventually they'll start having some other issues associated with the deficiency. So you always want to check for them and test them instead of just kind of assuming which one is which. But I wouldn't say that you would treat excess folate by giving more vitamin B12.
Yes. Yes, I agree with that. And there was an interesting published study that I was looking at from just recently, looked at the amounts of, they looked at the result of high dose folic acid supplementation. And what they found is they suspected that it could cause depletion of increase the severity of B12 deficiency. So interesting. Yeah. It's interesting. It's the authors kind of theorized that that's what could be happening, but given more B12, I haven't seen anything that can decrease folate. But I have seen one study that is showing the opposite, like excess folate can decrease. If you want to read more about it, it's called excess folate, folic acid and vitamin B12 deficiency, and it was published in the Food and Nutritional Bulletin. So this is, again, it's not a clinical study per se. It's more of a review article, but we typically give them both together. So and both are needed for methylation and for treating anemia as well. So that's typically how we do that. If there's doubt, and this is something I'll say, Janet, and for everybody here is listening, really, when there's doubt and you're like, okay, if I want to go beyond the general recommendations, if I want to do more personal, be more personalized to the patient and really be more precise, then testing is always the best approach. Because, if we don't test, we're guessing, right? Or guesstimating, right? Which sometimes is okay to do, especially as you develop more and more your clinical skills or your your kind of sixth sense. Let's call it that. And then the last question is regarding testing. It's best by blood. You mentioned red blood cells versus I think
Dr. You're mentioning like white blood cell. When we talk about red blood cell magnesium, that's just a test you can get like at Quest or LabCorp sometimes, like a simple way to get a measurement. But like Dr. Tall was mentioning, and like this, like micronutrient testing is a little bit better. It's looking at more so white blood cell levels of these things. So red blood cell versus white blood cell.
Yes, both could be good. It's just that the it's we know that red blood cells they have a 90 to 120 days, right, lifespan. So it could be beneficial, right? It's better than measuring serum, right? But it measures the intracellular storage. But the what we call micronutrient, the SpectraCell micronutrient test, really reflect the nutrient status over the last 4 to 6 months, right? Because it measures in the lymphocytes. So, and also it gives you an indication of over 30 different nutrients, including vitamins, minerals, amino acids, antioxidants, right? So that gives you a lot more. It's a little bit more pricey, but if the patient can afford it and you see the indication for it, then absolutely, it's a really good test. So with that being said, I want to thank Dr. Esha for being here.
Thank you.
Putting this together for us, this class and discussion. And I want to thank our media team for putting this also together, allowing us to connect with you wherever you are. And thank you also to Jacob for facilitating this class. And then I also want to thank each one of you for being here, taking the time and putting some effort and energy into developing your skills and bringing these unique solutions to your patients. So we're happy to be here with you. If you're one of our guests in this class today, feel free to reach out to us. The scholarships, $2,000 scholarship for the advanced program and the $2,000 scholarship for the functional weight loss certificate ends tomorrow, the end of the month. And then we're starting our next class, which could be the last class for what functional weight loss for this year. But we're starting this certification class next week, and we're meeting on Wednesday evening, and that's a one root cause every week for 2 months. And then we're also going to talk about the business of weight loss, offering memberships and programs to your patients. So if you're interested in that, reach out to us. We'll be happy to get you some more information. So thank you all for being here. Appreciate it. Hope you have a good evening, and we'll see you in the next class.
Thank you, everyone.